Hello, everyone, and welcome back to the Lube Tube. This is, I don't know what episode, called Save the Girls, the Lowdown on breast cancer screening. Do you remember what episode number we're on?
I think it's 8.
Okay, we're going to go with 8.
Okay.
All right, perfect. I'm Jeanette Nashke, and this is my co-host, Brittany.
Oh, that's when I say hi.
Yes.
Hey there.
Hi there. So I'm excited about this one because it's obviously Breast Cancer Awareness Month. It's October, and we have a guest speaker for this one, which I think is so cool.
Is it guest speaker or is it guest?
What guest?
I mean, guest speaker sounds like we're standing at a podium. Like,
Okay, well, what do you want to call her?
I think I'm a fabulous guest.
Okay.
We have a
fabulous guest today on our podcast. Her name is Dr. Sangeetha Kolluri, and we're going to introduce her in just a second. But basically, this episode is going to talk about all kinds of things, but mostly about breast cancer screening and why it's important and how it's done and your risk factors and what changes in your breast cancer screening depending on those risk factors. Everybody's different. Most women start at a certain age, but there are things that can change that age where you start breast screening. So anything to say about that, Brittany?
Also, we will be talking about mammograms, how to prepare for them, because that is definitely something all women will do at some point.
Yeah, and the fear of mammograms, right? We're going to talk about that. And just basically thinking certain thoughts about mammograms and why you should get them, or maybe fears of maybe I shouldn't get them, but we're going to try to debunk all of that. And so I think that's going to help a lot of these ladies out.
Good deal.
Awesome. So let me introduce Dr. Sangeetha Kolluri. She's actually a good friend of mine and also a physician that takes care of me personally. But Dr. Kolluri is a board-certified, fellowship-trained breast surgeon. She treats the complete spectrum of breast conditions from benign to malignant diseases at her clinic called the Wildflower Breast Center in downtown Austin and Kyle, Texas. After receiving her medical doctorate at the New York Institute of Technology College of Osteopathic Medicine, Dr. Kolluri completed her residency in general surgery in Flushing Hospital Medical Center and completed fellowship in breast surgical oncology at Texas Tech University Health Science. Oh, God, here we go. Whatever. What I like about Dr. Kolluri is that she deeply invests her time and her expertise in each of her patients, and she ensures that they receive a comprehensive, multidisciplinary treatment plan that is tailored to their needs. I know you know her personally as well, and I can absolutely say without a doubt, she is so good with her patients, and the amount of time and quality time that she spends with each of them to make sure that they're educated and they know what their plan is, I think is honestly the best I've ever seen.
Absolutely. And I often tell people about her and say that I go to Kyle to see her, which is not terribly far, but it's a drive.
Yeah.
And people wonder why are you going to drive there when there's specialists here?
She's worth it.
She's 100% worth it.
Yeah, I would. I mean, I've had appointments to go see her in Austin, and I would drive to see her just because I love her care that she gives and her education. And y'all are going to get to hear that, obviously. But she's real, and she keeps it very real, and she makes it fun. Obviously, when you're talking about something so heavy, she can really reassure. So, without further ado.
Y'all, her podcast voice is so nice too.
Yeah, right. I wish I could sound like her.
Oh, yeah. I mean, you have a good voice too.
Oh, thanks.
All right, y'all, here you go.
Okay, so Dr. Kolluri, why do you think breast cancer screening is so important?
Oh, well, it's my whole world, isn't it? I think it really comes down to a broader philosophical thing, which is, you have one life to live in this one body. And it's so important for us to know how to take care of our body and kind of read the owner's manual. So for your breast, that's such an easy and important thing to do. And I think in a way, that's a way of showing appreciation for your own body. I'm very much about body positivity, but I think taking care of one's health is a way to demonstrate self-body positivity, and a way to demonstrate self-love is to take care of it. And a big part of taking care of it is making sure that we are knowing what's healthy for our breasts and doing the things that are healthy for our breasts, and being aware that sometimes your breasts can get sick, sometimes diseases can happen. So let's be proactive about looking for those signs and symptoms and doing the screening tests.
Absolutely. That's like a great way to look at it too. And I talk to my ladies, a lot of them are either worried or scared or maybe haven't started screening because they don't know when to start screening. So can you tell us a little bit about types of screening and kind of when and what and where to start?
You got it. So for the average risk person, emphasize average risk, we're going to start mammograms at age 40 and we're going to do them yearly, not every 2 years, not starting at age 50. And we're going to continue those until we're 1 foot in the grave. So the more scientific way of saying that would be 10 years of quality life remaining. There's a lot of misinformation about whether insurance will pay for this. So let's start with insurance will pay for screening mammograms beginning at age 40, and they don't arbitrarily stop paying for mammograms at age 70 or 75. You can get a screening mammogram at 95, and Medicare does still pay for that. And that's, I think, a really crucial thing. Even if you're younger than 40 and you need an annual screening mammogram for your particular risk status, insurance does pay for that. I've never seen a case of a screening mammogram getting denied. But for the record, cash pay mammograms are not that expensive at all.
Okay.
They're really cheap.
Mm-hmm. So that's something that I also deal with in my clinic where maybe the patient comes in for their annual exam and they don't have insurance and they're pushing off a mammogram because they think it is expensive or they're waiting for cash to kind of flow in. But that is good to know that they are affordable because obviously they're needed a year.
I'm not aware of any cash pay mammogram in San Antonio or Austin that costs more than $200.
Okay. Good to know.
On a personal level, for me, when I had to get that MRI, my yearly MRI on my breast, it was significantly cheaper to do it cash pay.
That's correct. And I was so glad that you figured that out. And that's something that we just talked about recently with our local radiologist is what does cash pay pricing look like versus what does it pay with insurance? And if you think about it, like that's kind of the same thing you see with your prescription drugs. Like if you go, remember the $9 Walmart plan? Remember that?
Yeah.
Yeah, they're not billing your insurance. They're just having you pay a flat $9.
Right.
They're not troubling themselves to bill your insurance. That's why it was cheaper. And so you see that like a lot of times cash pay blood work is cheaper. A lot of cash pay things can be cheaper than trying to go through your insurance. And I don't want to go down the rabbit hole of why insurance sucks, but this is one of the many, many reasons why they suck.
Well, I also have had a lot of people also have been worried about doing their mammogram just because they're afraid of like a radiation. And I know that that's something that I've heard you talk about before is, there's not an increased risk of breast cancer just because we're getting mammograms yearly.
No, there's absolutely not. In fact, the dose of radiation is so low that it's equivalent to a flight to Denver.
Oh, really? That's a great.
Like, have you flown to Denver? Have you
Right.
ever taken a flight ever in your life that was more than 2 hours? There you go. You did a mammogram. That's it.
Okay. That's actually really good to know.
Same amount of radiation as what you receive totally naturally just walking around on Earth for 8 weeks.
Okay.
And the reason that, I get the focus on radiation, but what people don't realize is that the dose of radiation has gone lower and lower and lower and lower on mammograms. And it's because things are digital now.
Right.
Ye olde mammogram I swear to God, it used to be like a hand crank thing. Like I had a lady tell me this and I was like, oh my God, right? She's like, you youngins don't know.
Right.
But now they're all super, super high quality digital photographs. So the result is that they don't even need to do that much radiation to get a super high quality picture.
Right. So what is the difference between the regular mammogram and the 3D mammogram that a lot of these places offer?
Yeah. So 3D mammogram is an additional technology that for taking a few extra pictures affords the radiologist almost a way to kind of scroll back and forth on the images. Think of it like you're taking a ball and you're rotating it. That's basically what they're doing is they're able to kind of rotate your breast through the pictures and get a better sense of what's real and needs to be checked out and what's not real.
Okay.
3D is honestly a marketing term. That's a way, the real term is tomosynthesis, but almost nobody knows what that is. So they call it 3D, but in reality, it's not really a 3D picture. It's a marketing thing.
Gotcha.
But it's not marketing in that it is a worthwhile thing. Nowadays, 3D mammography is very much covered by insurance as part of your screening. It used to be you had to pay a little bit extra for the 3D mammogram. That's no longer the case. So if you have availability of a 3D mammogram near you, take it because your insurance pays for that anyways.
Okay, good deal. And then I know Brittany was just talking about how she has to get a breast MRI and me personally, I do as well, just because of my higher risk. How do you decide who needs what?
Well, I too am higher risk. So welcome to the club.
Yes, ladies.
Yes. So the American Society of Breast Surgeons recommends that everybody at age 25 and older undergo formal risk assessment. And what they mean is with a calculator called Tyrer-Cuzick version 8. We've now had a couple versions. So the latest and greatest is Tyrer-Cuzick version 8. Now, Tyrer-Cuzick is kind of hard to spell. So if you're listening to the podcast, you're not going to find it. Look for IBIS, IBIS, like the bird, IBIS, breast cancer risk calculator, and you'll find it. And you can click on it, and you're going to see it kind of looks like a stork. It's an ibis is sort of a bird that looks like a stork. And they're going to ask you questions, and then you're going to fill that out. Now, I don't recommend that patients on their own do this routinely. And the reason is because there is a lot of nuance that goes into filling out a risk calculator. For example, your breast density. And that letter they send you home with, oh, you have dense breast tissue. That letter doesn't actually tell you the category of density. For that, you have to go to the actual report that the radiologist, actually filed. So most patients don't have access to that. Most patients wouldn't know to look for that. So the problem with trying to fill it out at home is that you might not fill it out accurately. It's also common in our office for people to say, oh, I have a family history of ovarian cancer. And then when you really ask, it's cervical. Well, that's not the same thing at all. Or if you report a family history of breast cancer, then when you get more specifics, no, it was a benign breast mass that was removed. Okay, that's not the same thing either.
Right.
Or they had a cyst. Okay, that's not the same thing either. So there is a bit of nuance that goes into having a risk calculation, but that's something that your doctor should be able to guide you through. Certainly, I think most gynecologists nowadays are at least aware that these calculators do exist.
Right.
And you might not have time to do it at your annual visit, but you might consider making a separate visit, especially if you're worried about your risk calculation. Okay. Now, generally speaking, if you're over the age of 30 and your risk calculation is considered high risk, we would then consider adding an annual breast MRI in addition to the annual mammogram. Now, what is a normal risk and what is a high risk? Okay. The average person has a 1 in 8 chance of breast cancer. 1 in 8. If you shake that out with the numbers, it's like a 13-ish, 14-ish% lifetime risk of breast cancer. Okay. So anybody under 20%, we're going to call normal. Anybody over 20%, we're going to call high risk. But there are a lot of things that can contribute to your numbers changing. So you could be high risk and then it drops into the normal range. You could be normal and you could fall, jump into the higher range. A lot of things that can happen include changes in your gynecologic history, changes in your family history, and also changes in your breast density. So a lot of times you had dense breast tissue when you were young and beautiful, because that's what breasts are like when you're young and beautiful. And 55, they're not as dense and the density dropped. But the patient wasn't aware that the density dropped. It's just a natural part of aging. They never looked at the report to show that the density was dropping. And then we do a risk calculation. They're shocked to discover they have a normal lifetime risk because they thought they had dense breast tissue because someone told them that 20 years ago.
Right.
It's really accurate now. So there's a lot of things that can contribute to why you might be high risk for breast cancer. And we won't get into all of them specifically, but if you're high risk for breast cancer with a risk calculation greater than 20% and your age is over 30, you may qualify for an annual breast MRI in addition to your annual mammogram starting at the age appropriate age. Now, if there's not much young family history of breast cancer, we start you at 40. Mm-hmm. But let's say mom was diagnosed with breast cancer at 45, then we would start you 10 years minus mom's age. So that's 35. So you'll start 35. So that part is still a little bit different. But the point with the MRI is that it affords us not a better way to look at the tissue. It is not better, but it is another option, another additional tool that we can use. It does not replace the mammogram. If I have to put, gun to my head, if I have to pick one of the two, I pick the mammogram every time. I don't pick the MRI every time.
Really? Okay, good to know.
The mammogram catches 85% of all breast cancers. And if you think about it, that is darn good for a cheap x-ray that is widely available, that takes 2 minutes to do, that doesn't induce claustrophobia or anxiety.
Absolutely. Okay.
Widely available. MRI is a 40-minute study. It can cost thousands of dollars. You have to do IV contrast. You have to have an uncomfortable position, and you have to be in a narrow tube.
True.
And it's widely available.
Okay.
So I pick mammogram every time if I'm having to pick one of the two. That being said, if you are high risk, as the three of us are, we're all doing our mammograms and we're also getting our breast MRIs.
Right. I think that that's so important because I have so many people that come in and they're obviously they hear a lot of this common myths and misconceptions. Either they saw it on social media or their friends are talking about it. And one of the biggest ones that I have is, well, I don't get a mammogram every year because I have no family history, right? So they think they're not at risk of getting breast cancer. But I think that 1 in 8 kind of trumps that.
Yeah, it does. And the two biggest risk factors are being female and getting, it's not family history. Family history doesn't even make the top 2. It's being female and getting older. And last time I checked, we can't really change either of those risk factors. Putting aside the transgender community for a second, I'm talking about cis feels.
Right. Absolutely. So another common myth and misconception, because I think I see these a whole lot in ladies during their annual exam, is that they think that a lump is the only sign of breast cancer, right? That if they don't feel a lump, then they're okay. And so they don't think they should go get that mammogram or that screening breast exam.
Yeah, I think that that's a common thing. And I understand why that thought process is happening, right? Because they're trying to judge what's worth their time, because everyone's busy, what's worth their time for their health and what's not. So they're figuring, well, okay, if there's a cancer, I would feel it. So, and then I could always get the imaging at that time. But the problem is, by the time you feel something, that means it's not that small. That usually means it's already kind of big. And the point of a mammogram, the point of breast imaging, is that we want to catch things before they get that big. We'd love to catch things when they're really quite small and relatively easier to manage. So if we catch your breast cancer when it's non-invasive and it's a small area, then odds are you're going to get out of this with, for example, a lumpectomy plus or minus radiation and a pill.
Yeah.
But if you're waiting until you already felt it, at that point, it might already be big. It might be invasive. You might already have lymph, and you just bought yourself the whole shebang.
Right.
So the wise thing to do, and this is true of any cancer, it's not us. The wise thing to do is use screening to your advantage as a chance to catch things before they happen so that you stay in the driver's seat. That's what this is all about. Let's keep the patient, you, in the driver's seat so that your health is in your hands and not the other way around.
Okay. And one good question, and really quick yes or no answer. Do you think antiperspirants cause breast cancer?
Heck no. Except I was going to use a different word.
Okay. Okay. Good to know, because I do see a lot of that, and I see a lot of that on social media too. So thank you for answering that question.
No, it's so painful the way that happens. Yeah, it's so painful.
All right. That was really good.
Yes.
She's so smart.
She is.
Like another level, right? Like every time she just blurts out these facts, I'm like, holy crap.
I know.
Just know that off the
But
top
also
of your
just
head.
so real too, right? Like how nice that she can speak, at a different level, but you still understand what she's saying.
Right.
And it really is impactful.
I know. So, I'm so glad that I got to meet her.
I know. Me too. Thanks for introducing me.
You're welcome. Anytime. So I think it's important, like she touched on, that 1 in 8 women will develop breast cancer during their lifetime. 1 in 8. That's crazy. I know it's affected my personal life with my cousin. My dad's mom also had cancer. I guess you would call her my cousin. She's married in, but she also has been diagnosed with breast cancer. So I have a lot of breast cancer in my family, which is hence why I see Dr. Kolluri, because of my higher risk. But I know you personally have been touched by it too.
Yeah. My mom obviously went through, what was it? That's probably 3 or 4 years ago.
Yeah.
It was very quick. It happened very quickly. And very unexpected, but grateful. I'm grateful that we caught it when we did.
Yeah.
And she's doing great now.
Yeah, she's a rock star. I mean, Brittany's mom, if you were to ever come across or meet Brittany's mom, she lights up the room. And she is one of those people that can absolutely make you smile. And she is such a joy to my life. And I know that without her, we would definitely be a much sadder place. But she is, during her treatment, she remained positive. And just like my cousin, she always said, cancer sucks, right? But I'm going to work harder, right? And so, cancer itself affects very many people. Breast cancer, I feel like we're hearing about it more and more and more. And I don't know if it's because detection, we've got better detection. We've got people that are getting screening a lot more than they used to, but I'm just glad that we have these modalities for people and for women to basically get checked and more educated on it.
Right. Definitely. So I know that we talked, or I should say Dr. Kolluri talked a bit about mammograms, but beyond the mammogram, there are other things that can happen.
Oh,
right?
yeah, absolutely. And myself personally, I have to have a mammogram. And then 6 months later, I'm one of those patients that gets that MRI. And
Right. She talked about that. Yeah.
I don't know if any of y'all have ever had a breast MRI. And if you have, weigh in here. But the fact that you lay down on your chest and you put your boobs in a basket and you fly like Superman through this MRI machine, it is so awkward. It is awkward.
It's also uncomfortable, right?
100%.
Uncomfortable. Like you're laying face down and you're not supposed to move at all.
Nope.
Which makes it for anybody that has even a little bit of anxiety.
Yes.
When you're told not to move, what are you going to do?
You're going to move.
Yeah.
Mm-hmm.
I've had mine done multiple times at this point.
Oh, by the way, Brittany has to have the same screening I do.
Yes.
Mm-hmm.
I had it at one place and it was great. And there was music.
Oh, nice.
And there was I was able to look at this sunrise.
Oh, nice.
Then I had another one where there was no music.
Oh, that can make a difference.
Yes. And I was looking at a wall.
Oh, yeah, that's not fun.
So definitely if you find a place you like, stick with it.
Yeah. And you actually go to a different place than I do. And a lot of her change was because of insurance. And I know Dr. Kolluri and Brittany talked about this. But if your insurance is way expensive, do not be afraid to ask about the cash pay price, because like they mentioned earlier, cash pay can sometimes be a whole lot cheaper than what your insurance is going to charge you. So don't be afraid to ask the cash pay price.
Absolutely. Beyond the MRI, I know we also have ultrasounds.
Yes,
and
absolutely.
I think sometimes, and I've heard this recently, when someone has a mammogram and then they have to get an ultrasound, or I guess sometimes it happens.
Yeah.
Ultrasounds happen before the mammograms. That freaks people out.
Absolutely. The amount of callbacks. I know I look at mammogram reports all day long, and the amount of abnormal mammograms needs further imaging, which that usually means an ultrasound with sometimes a little bit higher def mammogram, the amount of callbacks that we have to give those patients. And that is so scary. But most of the time, it's all going to be okay. Most of the time, it's like a calcification or a shadow or something that's not totally normal on mammogram. And I just feel like these radiologists are going to be quicker to report, hey, I need more imaging rather than calling it normal, which I love that.
Yeah.
So I think that, I don't know, talking about maybe your risk. I know obviously you mentioned your mom, and obviously that is increasing your risk factor. Mine is also my risk factor with my family history. And she talked about the score and finding the website and going off, and we'll post that on our Instagram page and then also on our website. So y'all can click on that link to get your score, and talk about that with your gynecologist, talk about that with your provider, and figuring out what your risk is, because your risk is going to be different than me and Brittany's, right? And so if your score is over a certain number, that's going to require different types of imaging, right? And I know Dr. Kolluri touched on that a little bit, and I think that's important to know, because so many women out there, I bet, have a higher risk, and they're just doing a normal screening mammogram yearly when they could be getting further imaging.
Right. And then we're talking about people that have the BRCA gene.
Yeah. Mm-hmm.
And that's kind of a different, not, I shouldn't say a different story, but certainly something that needs to be taken seriously.
Oh, absolutely. Because the BRCA gene, which is a genetic test that can be done, and I think we should probably also do another episode with Dr. Kolluri about different genes, because BRCA1 and BRCA2 are not the only breast cancer genes. And she dives into that really deep when you go and see her, actually. And she will actually get a whole genetic risk profile for you, and can actually get this number for you, which is really, really important. But BRCA1 and BRCA2 require a whole different type of screening, whole different type of treatment. And, sometimes that's a surgical management, right? Which, like mastectomy and oophorectomy, which is the removal of the breast and removal of the ovary. But that's obviously a decision that's made by you, your breast surgeon, and your gynecologist. So when you come see me, right, for your annual mammogram, and say you're due for a mammogram, depending on your age, the amount of pushback I get and the amount of cringe face when I say, hey, you're 40, it's mammogram year, and the amount of, do I have to do that, right? Because they're scared, right? I Rightfully so. The mammogram, that sounds terrible. Somebody squishing your boobs between two metal plates.
Well, I think it's scary because of that, like pain.
Sure.
It's also scary of like the potential of what could be found.
Sure.
And I don't know how to fix that for people, right? Because mammograms have changed a lot, which Dr. Kolluri touched on. They're not the, yes, there is some squeezing and there could be some uncomfortable
Absolutely.
feeling to it. But for the most part, you really shouldn't be having this extreme pain
No way.
with mammograms.
No, I know that the many that I've had, remind me, when we go to work today, I got to schedule that. Okay.
Got
I'm
it.
due for mine. And if you are due, please pick up the phone after this podcast and go ahead and schedule it. Mammograms are not painful. They're uncomfortable and they are all of about 5 to 10 minutes. They are quick. These are not long processes. And depending on the images they get, which is going to be the mammogram tech, she'll be able to look at the images and say, oh yeah, you need one more view here or you need one more view here. It's actually a pretty quick process.
Yeah. I know we've already touched on this like multiple times, but I definitely want to say this again. Just because you don't have family history.
Yeah.
Does not mean that you shouldn't be getting screened.
I know. And a lot of women think that. They're like, well, I don't have, nobody in my family has breast cancer, so I don't need to get screened. That's not true. Breast cancer is not always genetic, right?
Yeah.
And I think Dr. Kolluri touched on that. It can be for other risks, right? It can be other out of the blue things that can happen. So absolutely, an annual screening mammogram is absolutely necessary. And how to prepare for that mammogram, right? Like, we talked about the pain and the tenderness. Actually, avoiding caffeine or high amounts of caffeine the week before you get your mammogram can be really helpful because caffeine actually increases that tenderness in that breast and it can make that a little bit less uncomfortable for you. And they also say not to wear deodorant. Gross.
Bring deodorant with you for after.
I still wear deodorant.
Oh, well, so
I know. Don't tell anybody.
Yikes.
So I wear deodorant and they have wipes and I wipe the deodorant off because they have wipes in the room. Girls, if you've never had a mammogram, this place sets you up, right? They've got this cute little gown that you put on. It's so comfortable in there. It's all girly in there. They've got deodorant for you. They've got wipes for you. They've got calming music. They usually have something on the TV that's really calming, like, I don't know, HGTV or something that makes me want to buy a house on the water. But don't be afraid. Those girls are there to help you. But anyways, I do wear deodorant. I wipe it off and then I do the mammogram and then I put more on.
Oh, okay. So you get rid of it before you do it. Okay.
I don't like to stink.
I understand.
You don't like to stink either.
No. Thank you.
Thank you. You're
I
welcome.
thought you were about to say something rude.
No, you always smell nice.
Oh, thank you.
Yeah. Brittany wears Versace. She always calls it Versace, but it's Versace.
Bright crystal.
It's so...
I'm giving away my secrets.
It smells so good. And then also don't wear like a dress to get a mammogram. And nobody ever reminds you of this, but you want to wear something that like pants or shorts on the bottom because you're going to be topless on the top and you don't want to walk out completely naked or in just your panties for a mammogram with your gown over you. Something to think about. Nobody thinks about that. Thought that was a good little tip.
No, that is a very good tip.
You're welcome.
Thank you. Thank you. Can we, I want to just say something before I forget.
Okay.
There, as we talked about, or as Dr. Kolluri talked about, the amount of radiation exposure you can get with a mammogram.
Yeah.
And how it is low. And she said equivalent to
a flight to Denver. 2 hours on a plane.
That's Denver airport.
It's nice.
Jeanette.
What? I haven't been to Denver.
Do you not know anything about the Denver airport?
No, I haven't been to the Denver airport probably since I was in high school.
Denver airport has so many. There's lots of conspiracy theories.
Oh,
one of the biggest ones involves tunnels and lizard people.
What?
Yes.
What are you talking about?
You have to read about it. It is wild. So that particular airport took far longer than it should have to be built.
Okay.
And there are underground tunnels that, granted, there's like a shuttle that's taking you know, to various places in the airport.
Yeah.
But there is a lot to be said about lizard people.
I have never.
And the Denver.
Where the hell do you come up with this shit?
And then there's this like huge stallion.
What? Like,
I guess it's like
a horse?
A huge horse. I don't know what you would call it.
Like a horseman?
No, when you leave the airport,
Okay.
there's this
Statue.
huge, thank you, statue.
Yes.
Brain fog. Sorry about that.
It's okay. We can fix that.
Yes. And it has eyes that are red.
What?
And I believe it's like blue. And
Uh-huh.
the man that was like the artist behind this died before it was actually completed.
Like the Denver Bronco
Maybe it's a Bronco.
for like the Denver Broncos. That's probably what it is, Brittany. For the
As
football team.
everybody knows, I know a little bit about a lot, but I don't know a lot about a little. So anyway, there's just lots of conspiracy theories.
Interesting. Now I
Yes.
gotta go read about it.
I know. I digress. Okay, let's
In
go.
41 years, I've never heard any of those stories. You always bring something great to the table.
You're welcome.
Yep.
You're welcome. Okay, going back though to the radiation piece.
Yes.
There will be some people that say, I don't want to get a mammogram. I don't want to get a mammogram.
You're right.
So what
Do I say?
options do they have? I mean,
Yeah, there are ladies every day that say, I'm not doing that.
Yeah.
Okay. Well, will you do something? Right. And so that's when I say, although it's not recommended, although the mammogram is recommended, let's get a breast ultrasound. Right. And if they are more comfortable with getting a breast ultrasound, at least it's some sort of screening. And I do order that.
Mhm.
I do, because yes, I'm going to do my clinical breast exam on you. Right. You're going to hopefully be doing your breast exams on yourself. But it would be important to have some sort of imaging to add to that.
Right. Okay. Let's talk a little bit about when you've done the mammogram
Mhm.
and then it's time to get your results and
Mhm.
you see abnormal.
How scary. How freaking scary. I know this personally has happened to me. I had a mammogram. It was abnormal. Basically asked for further imaging, which we talked about earlier. That included a diagnostic mammogram with ultrasound. And then actually that led to me getting a biopsy. And that biopsy and that fear of all of that was devastating. Like I was so scared. And thankfully it all came back benign. But in some women, it doesn't always come back benign. And so that fear that you have, because that's not a quick process, right? That's not. I mean, you get your mammogram, takes a couple days to a week to get the actual result back. Once it's abnormal, then you got to get scheduled for that extra imaging. And then the extra imaging happens. And then that takes a day or so to get report back. And then if it is abnormal, then they're going to do a biopsy. So then you got to schedule for the biopsy. Then you got to wait for the pathology to come back. So that could be a 3-week process.
But do you remember how cute your doctor was?
Oh my God.
And he was wearing boots
Oh my
with
God.
his scrubs.
So Brittany went with me to go. I'm getting all like giddy. Brittany went with me to get my breast MRI, and I actually needed a breast MRI, and they found something, and then I needed an MRI guided biopsy. So not only did I have to fly like Superman once, I had to do that twice with a needle going through my boob, right? So that was pretty intense. So Brittany, the great friend that she is, she went with me. And I'm pretty sure she was more interested in the radiologist than she was in
That's
me.
not true.
Bullshit. He was so cute. But talk about calming. He walked in, he's like, I'm not really too worried about this. I looked at it, but we're going to take a biopsy and it's all going to be good. And I'm like, okay. Don't worry, Daryl. I told you about this already. But anyways, I hope you yourself, if you have to go through that, have a really hot radiologist to take care of you.
Yes.
Mhm.
And also just, I think it's easy to go worst case scenario when you get an abnormal.
For sure.
So if you can, I know it's hard, it's way easier said than done, but
sure.
know that, I mean, there are certainly times when abnormal is completely benign.
Yeah, because now I've had 2 breast biopsies. Both were benign. So just because you have to have a biopsy doesn't mean that it's automatically going to have cancer cells, right?
Yeah.
So what did we talk about? We talked about a lot of stuff, right? I think recapping it is just the importance of getting screened, right? Whatever that screening means for you. That screening, for you and I, it's a mammogram and an MRI. For somebody else, it's just an annual screening mammogram. For the younger girls, right? So come and see me and you've got like a little breast nodule or something that's cystic, I'm probably just going to get an ultrasound, right? Because if you're less than 30, I usually just get an ultrasound. If you're 30 and up, you're probably going to get a mammogram. And then I really, like we talked about early, go get screened, go get that appointment, go to your gynecologist, get a breast exam, go to your PCP, whoever does your breast exams for you, go to them and get your mammogram order. Do it. It's not that hard, right? Just go get it done. And then I just think that there's certain places that if you want more information, you can obviously go to, and we'll put this on our website of different places that you can visit to get a little bit more information about screening and how to do it and where to go. But we can put that there so you can follow those links. And then also talking about the low cost mammogram. So say you're not insured. I know Kolluri touched on this too, but if you're uninsured, mammograms are not that crazy expensive. And I know sometimes specifically, there's a hospital here in San Antonio that does mobile mammograms, and they're actually free of cost. So go look at your local hospital's websites and see if they offer mobile mammogram. And mobile mammogram a lot of times does these pop-up clinics where they're free mammograms. And what a great thing, right? What a great thing to offer women.
Absolutely. And also to remember that early detection is key.
Absolutely.
It's so helpful.
Yep.
And
especially like with your mom, my cousin, right? Like
absolutely.
Early detection can sometimes, in certain breast cancers, save you from mastectomies, right? Could do just a lumpectomy. It can save you with your treatment plan moving forward. So getting these screenings done can definitely save you if something was to happen that like breast cancer.
Awesome. Okay. So we can't end this without some slippery solutions.
Slippery solutions.
B&J.
I think we need a jingle.
Okay.
Do you know anybody?
Do I know anybody that can sing?
Oh, yeah, you do.
Who?
Lauren Tyndall.
Oh my gosh. Yes.
Lauren Tyndall, can you please write us a jingle?
That's so great.
Mm-hmm.
Oh, okay.
Okay.
Number one.
Okay.
Dear B&J.
Mm-hmm.
They didn't say that, but still.
I like it.
I sometimes feel that nipple stimulation for my husband can lead to me having an orgasm.
Ooh.
Is this normal?
You lucky girl.
Honestly,
Right?
though.
Oh my gosh. You know, I have some women that nipple stimulation can absolutely lead to orgasm. And there are certain erotic zones of the female body that some of us don't even know about. So yeah, I absolutely would say this is totally normal and go with it. Don't be afraid. Don't be afraid. But yes, that is very normal. And depending on the patient, lady, depending on the lady, it can be a different place of her body. Some people it's the neck. Some people inner thigh, nipples, right? All kinds of things.
Ear.
Ooh, is that yours?
No.
You rub your earlobes.
Yikes.
Okay. Oh,
This one is like, I can almost like not.
oh God. Okay. I'm just going to
Shout
close
out.
my eyes and
No,
not look
shout
at
out to whoever sent this in.
Uh-huh.
The language is just so great.
Don't say her name.
I won't. Number 2.
Ready.
How do I get my husband to not treat my boobs like they are udders?
What?
I am not a cow, bro.
Right? Why do they do that sometimes? Like, quit sucking. You're not going to get milk out. Maybe you will on some ladies if you're breastfeeding. Absolutely. But oh my God. Well, I don't know how to answer that one.
Okay, well, first
Smack
of all, no. I mean, he might like that, but I think that there is something to be said about having enough pressure to where like there's good stimulation and then having too much where it's like, ow.
Yeah.
Ow, ow, ow.
Yeah, because obviously that's a super tender area of our body, right? So if they are just, milking it, is that the word?
No pun intended. I think it's all about communication, right?
Yeah.
Just letting him know, hey,
like
that doesn't feel good. Like it probably doesn't feel good when I like really yank on things for you either. So
do it to him. See what he thinks. Suck on his nipple like that. See what he says.
Yeah.
No?
Well, maybe. I don't know. I agree. That's a hard one.
It's a hard
but
one.
I think it just boils down to communication.
I think you're right. I think it comes back down to being like, hey, look, I don't like that.
Yeah.
Hey, try it this way. Sometimes just like educating them on what you like, kind of, I don't know, that can sometimes be a turn on.
Yeah. Right. Well, and as we've said many a times, most people want to are trying to please,
For
right?
sure.
So if you give them a little feedback and do it in the kindest way,
the kindest.
and although you did mention slapping, but I think there are better ways to do it.
Oh, okay.
But I think that's the only way we can answer this.
Okay.
But
Great question.
That was a great
Keep
question.
them coming.
I didn't think I was going to say udders today, but I did. So thank you, Dr. Kolluri.
Yes, thank you so much.
You are wonderful, and we can't wait to meet with you again and get some other topics under our belts.
Yes. I hope y'all enjoyed this. Share it with your friends. Share it with your ladies. Share it with your husbands so they're not using your nipples as udders. But anyways, I hope y'all have a great Thursday. Thanks for listening.
You can follow us.
Please follow us. And if you're not following us on Instagram, you should. I was going to tell them about our merchandise.
Oh, yes.
We have some
merch.
Yes, we have some new merchandise that should be coming out. We're looking into hats and shirts, but we shared one of the hats on our Instagram recently. And if you're interested, send us a message. They're really cute. Brittany got me one for my birthday, and it's so cute.
Does that mean you're officially 41?
Shut up. All right. Bye, guys.
Bye.
The information provided in this podcast is for general informational and educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare providers with any questions you may have regarding a medical condition. There is no provider-patient relationship formed. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. The hosts, guests, and producers of the podcast do not assume any liability for the application of the information discussed. Reliance on any information provided by this podcast is solely at your own risk.